We are facing a growing health crisis in the United States, one that is both alarming and deeply concerning. A resurgence of diseases we thought were nearly eradicated is now threatening our communities once again. This alarming trend is directly linked to declining vaccination rates, a problem that has been steadily growing over the past few years. Misinformation and fear, often spread through social media and other online platforms, have played a significant role in this decline. Infants who are too young to be fully vaccinated are especially vulnerable to these preventable diseases. Their tiny bodies are not yet equipped to fight off infections that vaccines can prevent. The recent deaths from whooping cough in Louisiana are a stark reminder of the importance of vaccination. These tragic losses highlight the real and present danger of vaccine-preventable diseases. These tragedies serve as a wake-up call. We cannot afford to be complacent about preventable diseases. The cost of inaction is measured in lives lost and families shattered. We have the tools to protect our communities, but these tools are only effective if we use them. Vaccines are one of the most powerful public health tools available to us. By understanding the risks of vaccine hesitancy and choosing to vaccinate ourselves and our children, we can create a safer, healthier future for everyone. It is a collective responsibility that we must all take seriously. The science is clear: vaccines save lives. They have been proven time and again to be safe and effective. By vaccinating, we not only protect ourselves but also those around us, especially the most vulnerable members of our society. Throughout history, vaccination campaigns have successfully eradicated or controlled many deadly diseases. Smallpox, once a feared killer, has been eradicated thanks to global vaccination efforts. It is crucial to follow recommended vaccine schedules to ensure maximum protection. Delaying or skipping vaccines can leave individuals and communities at risk. Public health initiatives and education are key to combating misinformation and encouraging vaccination. Community leaders, healthcare providers, and public health officials must work together to spread accurate information and build trust. Vaccination is a simple yet profound act of love and responsibility. It is a commitment to the well-being of our children, our families, and our communities. By choosing to vaccinate, we are choosing a future where preventable tragedies are a thing of the past. A future where our children can grow up healthy and safe, free from the fear of preventable diseases. This is not just a local issue, it is a global one. Vaccination efforts must be supported worldwide to ensure that everyone, regardless of where they live, has access to life-saving vaccines. Together, we can make a difference. Together, we can ensure that preventable tragedies remain in the past and that our future is one of health, safety, and well-being for all. Whooping cough, also known as pertussis, is a highly contagious respiratory infection. It is particularly dangerous, even deadly, for infants. The disease often starts with cold-like symptoms, a runny nose, sneezing, and a mild cough. However, this seemingly harmless beginning can quickly escalate. The cough worsens, turning into uncontrollable coughing fits. These fits can be so severe that they make it difficult for babies to breathe. Infants may turn blue from lack of oxygen, a terrifying symptom for any parent. In extreme cases, these coughing fits can lead to pneumonia, seizures, brain damage, and even death. The good news is that we have a safe and effective vaccine to prevent whooping cough, the Tdap vaccine. This vaccine is a crucial tool in our fight against several serious diseases. It not only protects individuals, but also helps in safeguarding entire communities by preventing the spread of infections. The Tdap vaccine protects against 3 diseases: tetanus, diphtheria, and pertussis. Tetanus, often known as lockjaw, can cause painful muscle stiffness and lockjaw, making it difficult to open the mouth or swallow. Diphtheria can lead to breathing problems, heart failure, and even death. Pertussis, or whooping cough, is a highly contagious respiratory disease known for uncontrollable, violent coughing, which can make it hard to breathe. It is routinely given to children in 5 doses, starting at 2 months of age. These doses are crucial in building up a child's immunity over time. The initial doses are given at 2, 4, and 6 months, followed by booster doses at 15, 18 months, and 4, 6 years. This schedule ensures that children are protected during their most vulnerable years. A booster dose is recommended for preteens and adults. This booster is typically given at 11, 12 years of age, and adults are advised to get a Tdap booster every 10 years. Pregnant women are also recommended to get the Tdap vaccine during each pregnancy to protect their newborns from pertussis. Unfortunately, vaccination rates for Tdap and other routine childhood vaccines have been falling in recent years. This decline is alarming because it undermines the progress we've made in controlling these diseases. Lower vaccination rates can lead to the resurgence of diseases that were once under control. This decline is partly due to the spread of misinformation and unfounded fears about vaccine safety. Social media platforms and other sources have contributed to the spread of false information, causing confusion and fear among parents. It's important to rely on credible sources and consult healthcare professionals when making decisions about vaccinations. This trend is extremely concerning because it leaves communities vulnerable to outbreaks of preventable diseases like whooping cough. When vaccination rates drop, herd immunity is compromised, putting at risk those who cannot be vaccinated, such as infants and individuals with certain medical conditions. It's crucial to address these concerns and ensure that accurate information about the safety and benefits of vaccines is widely available. The COVID-19 pandemic brought the importance of vaccines to the forefront of public discussion. Unfortunately, it also fueled a surge in misinformation and distrust in vaccines. While it's understandable to have questions about new vaccines, it's crucial to rely on credible sources of information. The safety and effectiveness of vaccines are rigorously tested and backed by decades of scientific evidence. The benefits of vaccination far outweigh the risks. Choosing to vaccinate is not just a personal decision, it's a responsibility we have to our communities, especially to those who are most vulnerable. Section 5. Echoes of the Past. Measles returns to Texas. The resurgence of preventable diseases is not limited to whooping cough. Recently, West Texas experienced a measles outbreak. Measles is highly contagious and can cause serious complications, particularly in young children. Like whooping cough, measles was nearly eliminated in the United States thanks to widespread vaccination. However, even a small decline in vaccination rates can create an opportunity for these diseases to reappear. The Texas outbreak serves as a stark reminder that we are not immune to the threat of vaccine-preventable diseases. Section 6. Beyond outbreaks. The importance of herd immunity. When enough people in a community are vaccinated, it creates a phenomenon called herd immunity. Herd immunity helps protect those who cannot be vaccinated, such as infants, pregnant women, and people with compromised immune systems. When vaccination rates decline, herd immunity weakens, leaving everyone vulnerable. Maintaining high vaccination rates is crucial for protecting not only ourselves, but also the most vulnerable members of our society. It's a collective responsibility that we all share. Section 7. The Anti-Vaccine Movement. A history of misinformation. The anti-vaccine movement has a long and troubling history. It dates back to the early days of vaccination when smallpox vaccines were first introduced. Even then, there were groups of people who were skeptical and fearful of the new medical intervention. Over the years, this skepticism has evolved and taken on new forms, often fueled by misinformation and fear. One of the most damaging events in recent times was the publication of a fraudulent research paper in 1998 that falsely linked the MMR vaccine to autism. This paper, authored by Andrew Wakefield, caused widespread panic and led to a significant decline in vaccination rates. The media coverage at the time amplified the fear, and many parents were left confused and worried about the safety of vaccines. This study has been thoroughly debunked and retracted, but the damage was done. The scientific community quickly responded, conducting numerous studies that found no link between the MMR vaccine and autism. Despite this, the initial false claims had already taken root in the public consciousness, and the anti-vaccine movement gained momentum. The false claims about vaccines have persisted and spread rapidly online, creating fear and distrust among parents. Social media platforms have become breeding grounds for misinformation, where false narratives can spread like wildfire. Parents concerned for their children's health often find themselves bombarded with conflicting information, making it difficult to discern fact from fiction. It's crucial to remember that vaccines undergo rigorous testing and safety protocols before they are made available to the public. Each vaccine is subjected to multiple phases of clinical trials, involving thousands of participants to ensure its safety and efficacy. Regulatory agencies around the world, such as the FDA and WHO, closely monitor the development and distribution of vaccines to protect public health. The science is clear. Vaccines are safe and effective. They have eradicated deadly diseases like smallpox and have brought us to the brink of eliminating others, such as polio. Vaccines not only protect individuals but also contribute to herd immunity, safeguarding entire communities. By vaccinating our children, we are not only protecting them but also ensuring a healthier future for everyone. Section 8. A plea for trust. Your doctor and scientific consensus. In the age of information overload, it can be challenging to know what to believe. When it comes to your health, especially the health of your children, it's essential to rely on trusted sources of information. Your doctor should be your primary source for information about vaccines. Doctors spend years studying medicine and understanding the complex workings of the human body. They are trained to separate fact from fiction and to provide evidence-based medical advice. Trust your doctor's recommendations and don't hesitate to ask them any questions you may have about vaccines. Section 9. Protecting our future. Vaccines as a shared responsibility. The resurgence of preventable diseases like whooping, cough, and measles is a serious public health concern. We must act now to reverse the trend of vaccine hesitancy and protect our communities. Vaccination is not just a personal choice, it's a shared responsibility. By choosing to vaccinate, we are not only protecting ourselves but also those who cannot be vaccinated. We are ensuring a healthier future for our children and grandchildren. Let's work together to